A disc bulge or a disc herniation doesn't mean surgery. Hey folks, I'm Dr. Jeff Williams with Creekstone coming to you with another video. This week we're talking about scary disc injuries, and they really are scary. This information, listen, I'm telling you, your friends and family need this information. We see so many needless back surgeries, but we see them after the fact usually, after they're already done, after we can no longer do anything about it. So share this information, this video with your loved one, with your people, so that we can do something about the disc injuries before they ever get to the surgeon. Share it. Help your people out, okay? I see it in my patients' faces almost every week when I tell them that I believe their back pain is due to an injured disc in their spine. Their faces, they just kind of sink. Their eyes look down at the floor and they take a deep breath and let it out slowly, just kind of dejected, right? For just a moment, it's pretty heavy. And you can see the weight of the information I'm sharing with them. You can see the weight of it just hitting them at full force. And before they have a chance to take that second breath, though, fortunately, I have the pleasure of being able to tell them that they're not stuck this way. And typically, they're not going to have to deal with any shots or surgery. And then I watch as relief drifts back over them. Now here's a factoid. Did you know that disc injury is the most common reason for a patient under the age of 50 to have back pain? And that's the reason I see this scenario play out so often, because it's so common. But here's another factoid. Out of about 56 million Americans suffering from back pain, of which disc injury is the most common reason, only about 5% of that 56 million actually require any kind of surgery. And that's amazing news. The truth is, most patients just don't need surgery at all. The only real reasons to have back surgery are usually progressive neurological deficits, unrelenting, life-changing pain, and or Cotta Aquina syndrome. So don't go anywhere. Don't let those big words run you off, because I'm going to explain them real briefly, and it's going to make perfect sense. So let's talk about, first of all, let's talk about progressive neurological deficit, okay? Progressive neurological deficit refers to your reflexes, like when the doctor taps you with the reflex hammer and your leg goes boink. If one reflex is gone compared to the other side of the body, that's an example of a neurological deficit. If you have, for example, noticeable weakness in muscles on one side of the body compared to the other side, that's a deficit. And finally, if you feel things differently, your sensory, if somebody's scratching you on one side versus the other, so like one aspect of a leg, a foot, arm, or a hand, for example, if you feel that scratch differently in the same spot when you compare it to the other side of the body, well, that's a deficit as well. The second one we'll talk about is called Cotta Aquina syndrome. The calling card of Cotta Aquina is the altered ability to control bowel or bladder function, and or saddle anesthesia is sometimes that's combined with the inability to control bowel or bladder function. Saddle anesthesia means having numbness or tingling in really any area up and underneath between the legs that would touch a saddle when you're sitting on it. Now, this condition is an emergency. It needs to be seen in the emergency room as soon as possible. Now, the last one I mentioned that we'll talk about is unrelenting, life-changing pain. Now, patients that are suffering from pain, they don't appreciate hearing this, but pain by itself is not typically a reason for having surgery. However, unrelenting, life-changing pain, that takes a second look. There are steps to be tried prior to that surgery, though. Pain that cannot be relieved requires investigation. You can't find a comfortable spot at all, you need to look further. X-rays and MRIs are likely in order for that kind of pain when you're very first starting out. Assuming there's no obvious reason for the pain on the imaging, the X-rays, MRIs, well then, according to the recommendations from the American College of Physicians, then you start treating with spinal manipulative therapy, exercise, heat, low-level laser, Massage, acupuncture, and cognitive behavioral therapy. Those are for starters. And I keep pointing at myself because we do all but one of those things. Assuming that those things fail, and let me be clear, they almost never fail, by the way. But assuming they fail, then the patient would go through a trial of medication, followed by a trial of shots. And assuming everything else failed, the patient would undergo surgery in an attempt to provide some level of relief. But again, I want to reiterate and emphasize, and all capital letters, this is a very rare occurrence. It almost never happens. Now that we've covered the three most common reasons for surgery, and we've also covered the fact that the most common reason for low back pain is a disc injury, things like disc bulge, disc herniation, disc desiccation, disc dehydration, annular fissure, things like that. Those are the most common reasons. Now that we've covered all that, let me talk about how surgery is typically avoided through non-invasive, non-pharmacological, conservative treatment. The first thing to know about a disc injury is that they're usually self-resolving. If given time, many of them simply go away on their own eventually. So why would you need a chiropractor or a physical therapist or anyone else? And that's because we can speed the process up. If you've ever been in the grip of disc injury pain, oh my goodness, you know why it is imperative to get out of it as quickly as possible. Pain from a disc injury is honestly about as bad as it can get. When a patient is unable to get themselves to the bathroom without any assistance, when you can't do that, then you understand the level of pain I'm talking about. It's for real. If a practitioner is able to shave a week or more off of that type of pain, most patients will agree that that is well worth the money, worth every penny spent. As far as treatment for the disc injury goes, I can only speak for myself, okay? I have fellowship training in orthopedics and neuromusculoskeletal medicine. So for me, my treatment, it may look different than other practitioners' treatment looks. The first thing I'm going to do is determine how long the pain's been there. How long's it been going on? And that's going to give me some idea about whether we need to have a talk about chronic pain and everything that is involved in chronic pain. And then I'm going to check for progressive neurological deficits and Cotta Aquina syndrome, like we talked about. And then it's on to questions about the pain. Does walking help or hurt? Does it hurt to roll over in bed? What's your best position between sitting, standing, and lying down? What's your worst of those positions? Does it hurt to cough or sneeze? Does it hurt to stand up from a chair? What happens to the pain when you bend over to touch your toes? What happens to the pain when you bend backwards? Where does the pain hurt exactly? Can you take one finger and can you point to one spot and show me exactly where it's coming from? All of these questions, they're really, really helpful in me narrowing down exactly what is going on with the patient. If we can determine that it's a disc, well, then we can move on to finding movements, exercises, and strategies that can help the patient recover quickly and self-manage at home between visits in the clinic. When these patients are in the office with us, we use spinal manipulative therapy because movement is healing all the way down to each individual segment in the spine. We use exercise, decompression, and low-level laser as well. In addition, I'm going to be giving my patients recommendations on how to move in the future to avoid these types of injuries going down the road. We call the discussion a talk on biomechanics, how the body moves, basically. That's what we're talking about when we say biomechanics. I talk to them about how to use their back properly and help their back protect itself, and what kind of movements are harmful. For example, many times patients think that stretching by bending forward at the waist is good for stretching the low back, when in fact, this could be furthering the disc injury. Some patients need to understand when forward bending is okay and when forward bending is harmful. For example, yoga is great, but not every movement in yoga is great, right? And not everyone is the same. So you need to be going to someone that can guide you correctly based on knowledge, education, and experience. This is vital to recovering quickly and completely from something as serious as a disc injury. As I mentioned briefly, we commonly use non-surgical spinal decompression combined with low-level laser. These two modalities can really provide us a lot of leverage when dealing with a disc injury. Decompression places gentle traction on the discs, helping to decrease pressure on the nerves there in the area in an attempt to reduce the herniation or bulge while trying to rehydrate the disc to an extent. The low-level laser, when you throw it in on top, that's also known as cold laser. It's used to reduce the inflammation in the area and calm everything down to whatever extent as possible. I have honestly never seen anything as effective for disc injuries as non-surgical decompression when you combine it with cold laser. It's literally a game changer for back pain that's caused by disc herniations and other disc injuries. So, if you get diagnosed with a bulging disc or a herniated disc, don't lose hope. There is rarely any reason to ever undergo surgery. It can usually be resolved quickly and safely with the help of a specialized and knowledgeable chiropractor. And you should be back on your feet before you know it, with the right help and the right attitude. Again, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas. Make sure you share this video with your people. Help save someone from surgery, won't you? If you're watching on YouTube, subscribe, comment, and share. If you're watching on Facebook, like, comment, and share. It's the way the interwebs work these days. If you're from Amarillo or the area, or you're going to be traveling through our area and you need to be seen, give us a call at 806-355-3000 and let's get you on the schedule. Until next week, stay safe, be well.